Hello, everyone. And this is our final live for this week. It's been a busy week, and what an incredible array of women I've had the privilege of chatting to and bringing to you. And of course, today's awesome human is exactly in the same category, and that is Dr. Sarah Hancock. Thank you so much for joining us and also being part of the summit.
Oh, well, thank you. It's an honour to be part of the summit. I'm really looking forward to it. I've really enjoyed the chat so far. It's
Yes,
been
yes,
amazing. Yeah.
it is.
I think
And
I'm looking forward to seeing the talks as much as everyone else, because there's an amazing bunch of women who are bringing so much knowledge and thought into their presentations, and care and a desire to, improve the health of all of us, and using all their skills and talents to do so. So this is going to be fantastic.
That's a beautiful way of saying it, Sarah, because it's exactly true. The commitment and the heart behind every single one of the presenters is just phenomenal, and it shows up in the work that they do and the passion behind the work they do, and then how they end up putting that out into the world. And yeah, that's really lovely, and you're a huge part of that, Sarah. You have an accent, so would you like to start by just sharing with anyone who doesn't know who you are, where you come from and what it is that you do?
What does I do? Well, I'm Dr. Sarah Hancock, and I graduated last year with a PhD in public health nutrition from Auckland University of Technology. And my thesis, and I live in New Zealand, so I grew up in the central South Island, and I'm currently residing in Taupo in the central North Island. So I've gone from the middle of one island to the middle of another, and where I live with husband and daughters, although one of them's flown the coop and gone to university, and we've got a 16-year-old at home. And so I did the PhD in public health nutrition with an oral health focus, which has been absolutely fascinating, because dental health has been treated so separately from general health and in the nutrition space. And of course, there are some problems, that we've got with dental caries in children, but actually it's a really early alarm bell, which rings very, very loudly, because it is accompanied by pain and distress, and has a huge public and private health cost. But it is an early indicator of poor metabolic health, and it could be an early warning sign that there might be other members of a family, when a child is presenting with dental caries, that have similar problems with oral health, and therefore at risk of chronic metabolic disease. And so, so there's going to be a lot to cover tonight, but that's where I'm at the moment, and just in the business of getting papers published, and just working with another professor of oral health at AUT, and just getting all this work up and running and getting it out there more in the community, and creating some change with how we regard dental health, and also what we should do about prevention in the face of relatively little political will to actually make these changes, because of the problems with the ultra-processed food environment that, we have to live amongst and work amongst, and, that presents some very real barriers to achieving some go forward, I would say, in prevention of chronic disease.
What fascinating work that you do. And I think it's just so not spoken about enough. I mean, just the fact that you say, it's almost a gift. I mean, if we could really get people to see, hey, it's not a gift to get these things, but if you pay attention to what's going on at that young age, as to what's going on in their mouth, it could really save them from so much, pain and trauma further down the track. So why is that? What's the disconnect? What's happening?
Well, there's a lot of disconnects. I think there's a lot of how medicine is essentially organised. There's very little funding put into prevention, but it all seems to be this very much an ambulance at the bottom of the cliff. And so what happens is people are sort of moving through life, but until they then get a diagnosis of pre-diabetes or type 2 diabetes, and it often happens at sort of that later stages of life, but increasingly we're seeing this being diagnosed much earlier. But also where we might be able to intervene earlier is when families and children are connecting with the health system is particularly around pregnancy and early childhood. And maybe that needs to be a focus of chronic disease prevention for everyone in the family unit. And because possibly by the time people are diagnosed with type 2 diabetes, well, that's the beginning of end-stage disease, really, isn't it? If your pancreas or your insulin production isn't keeping up, or isn't adequate for helping to maintain blood glucose homeostasis, things are really starting to go badly wrong. And so possibly, if a child is presenting with dental caries, and what I am going to talk about in my presentation is how it's not just a local within mouth reaction, but it is driven, or the caries process through cavitation is driven by a systemic inflammatory process, which is really important because that systemic inflammatory process is accompanied by similar hormonal and metabolic pathway dysfunction as what presents with hyperinsulinemia as well too, which is fascinating, really.
It is fascinating. And I think, for the everyday person, hearing that, basically what it's saying is, if your mouth isn't working properly, then there's, fundamentally things going wrong metabolically in your body. And, we need to pay attention to it. And it's interesting, isn't it, how you said, we tend to see it separate. Well, we tend to see everything separate. I think that's such a fundamental big problem, isn't it? The brain is one part, the gut's one part, the limbs are this part, and then the mouth is separate, but it's not.
Oh, it's not. And the mouth is actually at the very top of the gastrointestinal system anyway. And because there's a lot of digestion of food happens in the mouth, but also we know that the oral microbiota is actually a really good reflection of what might be happening down in the gut as well too. And so there's some interesting ideas around vitamin deficiency and the accumulation of plaque or tartar in the mouth as well too. And, which I think is fascinating. And especially when, it was the discovery of the plaque on teeth, of people living in, or humans living in Neolithic times, where agriculture got started, but that was accompanied by the appearance of this plaque, which was characterized by a reduction in diversity of the biome, which is exactly the process that happens when we ingest refined carbohydrates. There's the metabolism of those by bacteria produces acid, which has an impact on the enamel. But also, there's the sugar actually acts with particular types of bacteria, because we've got a whole set of bacteria in our mouths. There's various different types, and they've been there ever since. From
it's
time.
It's got its own.
Once you put the sugar in, there's some that proliferate. It's kind of like, I don't know. You can have a whole lot of cats as pets, can't you? But that tiger probably needs to be kept under a few restraints, because if that gets out of control, it's going to make a mess everywhere. There's going to be chaos and destruction.
I like it.
But if you take the controls off that lion, like let it out of take off the gold leash or whatever you do, it's just going to run amok. And something like that happens in the mouth. But that doesn't entirely answer the question of how caries forms, because there are different ways that we can get acid into the mouth. People who have gastrointestinal reflux will frequently have acid in the mouth, and people who consume citrus-based drinks, there'll be some acid in the mouth like that, but it's not associated with the tooth destruction, with that rotting from the inside out. And that's quite important when we look at the high and frequent intake, and it's a frequency of intake which seems to be the key. And of course, that's driven by the way these ultra-processed foods are packaged, and there's a lot of food addiction in that, and the lack of satiety, and so it drives a pattern of high frequency carb consumption, which is absolutely terrible for teeth.
Yes. And I can't imagine ever visiting a dentist that would actually, apart from saying, I think, they might say, don't eat sugar, or, don't eat too much sugar, but you would be forgiven for thinking it's just about oral hygiene. And if you get cavities, then you're not cleaning your teeth properly, or, but clearly it's much more about, what we eat.
Diet is the primary driver. I mean, people 100 years ago in New Zealand had beautiful teeth, including East Coast Maori. In fact, actually, Weston A. Price identified that particular group of New Zealanders as having the best oral health. That's not the case now. The people in that part of New Zealand, especially 5-year-olds, they have amongst the worst dental health stats of anywhere in New Zealand, and it's absolutely tragic that that's the case. And so people had good oral health without Lumino, the dentists, or other hygiene providers. But also the growth of the oral hygiene industry is really fascinating. And I'll send you a link to a paper by Philippe Hujol on that. And that, there was this idea, and it was driven by the social hygiene movements, that tuberculosis occurred as a result of one of the things driving tuberculosis was an unclean mouth. And that to prevent tuberculosis, you should have a clean mouth. And of course, that sort of went hand in hand with some of these other progressive reformer movements of the time. And then, of course, it was a way to make a quick buck because, we've got all these hygiene products. And, of course, the American Dental Association were charged with, well, what do we do with these? Are these of therapeutic benefit, or should we be just popping them in as nice to haves alongside lipstick and mascara or things like that, as far as, how to sell these? And they decided that there was actually no real basis for improved oral health with these. But, of course, the toothpaste companies weren't thrilled about that. But then there was some parallel to that. There was the blaming of fat for cardiovascular disease. And, of course, the sugar industry said, well, yeah, just clean your teeth and you can eat whatever you like and you'll be fine. And then, of course, decades later, the dietary guidelines came in. It must have been really difficult being a dentist in that space because suddenly you've got this very anti-fat movement or recommendations to reduce the amount of fat, but to eat carbohydrate-based foods. And for children, our dietary recommendations are having these foods multiple times per day, like up to 6 times per day if you're an adolescent. And so maybe that's where the focus of caries prevention then swung very much into changing behaviours such as brushing your teeth and that sort of thing, given the disconnects between what dentists had grown up knowing about as far as caries prevention through dietary means goes. Yeah.
It's fascinating stuff, Sarah. At the summit last year, so I interviewed you as part of a bonus interview and learned all this. And I have to be honest, for the first time in my life, I'd never come across this information. And I think it's just so important. Ties in just so beautifully with, if we want to be healthy in our brain, we want to be healthy in our heart, we want to be healthy in our, our pancreas and our liver, and now our mouth. It's so much about what we eat. And I'm going to absolutely share that conversation we had so people who purchased the summit will get access to previous, presenters. And that was just such a fascinating conversation. And I think what you're sharing and what you've done and the work you've done and continue to do is just so, so important. Just a final question, Sarah, before I let you go, is, so in terms of people, if they come to the summit and they watch your presentation, are they going to are you able to give us a little bit of maybe some practical something, a little snippet that they're going to walk away with?
Hopefully what everyone will get up from the summit and walk away with is an appreciation that your mouth, which we use to smile and talk and communicate and everything like that. I mean, the first thing we did when we hopped on tonight was smile at each other. And that's actually, the mouth health is not to be treated separately. And that what you eat has an impact on inflammatory markers as well as bacteria in your mouth. But I'm going to give 3 main take homes. Will be the importance of not snacking on ultra-processed foods is absolutely imperative. If you can do one thing to reduce your risk of tooth decay, because it does occur more in adults through the life course, that's really, really important. And so on top of reducing your consumption of those foods, just don't do the between meal snacking of those foods is actually really, really quite harmful oral health wise. The good news is that a low carbohydrate, healthy fat diet or the keto diet is actually shown to be associated with good oral health outcomes. Because, and particularly with full fat dairy produce, is associated with protection. And that's been known for coming up 100 years now.
Oh my goodness.
I know.
Wow.
That's great. And vitamin D rich products such as your eggs, your fatty fish, and your grass-based beef as well too, and lamb, or your red meat, because of the bioavailability of vitamins and minerals that are important for oral health. And I'm going to go into that quite a bit in the talk, that these are your vitamins and minerals, and that these are associated with benefit for oral health, because for ongoing development and maintenance of tooth health. And so those are the two most important things. And just to try and, so we've got the ultra-processed food intake, got to the importance of meat and fat, but also a bonus one for practitioners, or the third one for practitioners, is that it's going to be increasingly important to look at dietary intervention at early childhood, and maybe take a whole family view around prevention of chronic disease, and that you can actually get started with preventing cardiovascular disease. Because often when, you and I have had children and you go in there, it's all about baby's health. But, there's also getting people started on that, because the public costs of anaesthetizing preschoolers to remove multiple teeth is huge. In New Zealand, we spend about 150,000 a day on that single operation.
Phenomenal. It has to be higher here in Australia.
Wow. It's just dreadful, and it's preventable. So there's the reduction of ultra-processed or snacking of ultra-processed foods. Eat 3 meals a day. The importance of dairy produce and vitamin D rich foods, and I'm going to go into more details of those in the summit. But also, and for the practitioners, but I think they're also, what we can all do is recognize that the food environment that we live in is a massive barrier for health.
Yeah,
and
full stop.
Actually, some of the best change will happen from the ground up, because there are too many people who haven't changed their minds or are not willing to change their minds. But actually, we need all of you and me and everyone else to actually actively work in minimizing the impact of the food environment that we live in on chronic disease.
Yeah. It's a big job, but one person can make a really big difference, and certainly not doing anything, that's why I just think we can't force people to want to see something that they don't want to see, but we can't also stop talking and sharing about what we do know.
We can't stop talking, but I think there's moral obligation in there if we're in the field of health, and for health practitioners, and the recognition that actually some of the people best placed to deal with this, because their sheer level of engagement with families, are nurses, midwives, because young families all look to those people. What am I best to feed my children? And it's not that stuff that comes out of a jar, say banana and custard, where banana might be 2% of the whole concoction. Yeah,
I know it does. It's just, unfortunately, I think the rubbish that we do tend to feed our kids is just, it's so innocent, because we're told it's healthy, I mean, I certainly was there with my older kids, the rice cereal, and then straight to the convenience foods, because again, remember, we're convinced we don't have time to prepare and to cook. And I know there is a lot we can do. And you're right, there is a moral obligation for people who are telling people about health to have the right information and the accurate information to give people. Well, Sarah, I think your talk is going to be amazing, and it's, as I said, it's just such important information. And also, as I said, I'll have the chat that we did last year in last year's summit. Just mind-blowing. Still never forget, I got off that one. I'm like, okay, to my husband, you need to sit down. I've got some stuff to tell you. It's amazing. But brilliant. Great to see you again. Thanks so much for your part of the summit and for sharing with us today. And yeah, I look forward to seeing you very soon.
Well, it's lovely to see you too and catch up like this. Yeah,
we should do it more often. We absolutely should, but we'll end the live and we'll talk for a bit. So don't go. Okay. Bye, everyone.
Bye.